This is your reality check.
Welcome to The Reality Check, the weekly Canadian show that explores a wide range of controversies and curiosities using science and critical thinking. Today is March 5th, 2021, and I'm producer Pat. We have a couple of interesting segments for you today. We're going to throw the entire show over to the Ottawa crew. Adam looks at the Mr. Potato Head stories that have been popping up in the news headlines and wonders, do potatoes have two genders? But first, Darren digs into the question of whether COVID kills more men. I hope everyone out there is staying safe and healthy, and we will talk to you soon.
A few weeks ago, a friend posted an article about how the pandemic has been hitting women especially hard because women make up the majority of workers in a lot of frontline service jobs that have been hit hard by the pandemic. And women often have greater care responsibilities at home, whether it's children, elderly, or other. On this post, someone commented how the article completely missed the point because COVID-19 mainly kills men, so the fact that this isn't getting any attention is the problem. What's this? COVID-19 kills men more than women? I hadn't heard this. Is this true? Some quick Googling did have some headlines that assumed the information is true, but let's look at a couple studies, as it sure would be nice to have more rigorous information whether this is true. There was a paper published in The Lancet in August 2020 by Bhopal and Bhopal with the title, Sex Differential in COVID-19 Mortality Varies Markedly by Age. Quote, we examined the sex ratio through the life course to see if the COVID-19 mortality sex differential was the same at every age. We analyzed data collected by the National Institute for Demographic Studies from national statistical agencies across England and Wales, France, Germany, Italy, Netherlands, Portugal, Korea, and Spain, covering an estimated population of 194 million men and 202 million women from the beginning of the pandemic until June 21st, 2020. I rounded both those numbers, and I will also round the following ones. Over the time period, 78,000 men and 60,000 women died. Per 100,000 population, the overall male-to-female mortality sex ratio was about 1.4 to 1.
Wow.
Meaning 1.4 men had died for every one woman.
Yeah.
They state that this wasn't equal at all ages. Under the age of 10, women die 20% more. But in most of the demographics, it is more men that are dying, and we know COVID mainly kills the elderly. Yeah. So, for example, from 40 to 49, 1.9 times as many men died compared to women. Damn. From ages 50 to 59, it's 2.3 times as many men. It's 2.56 times as many men in the 60 to 69 bracket, and in the 70 to 79, it's 2.36 times as many men as women. And finally, in the older than 80 category, it's 1.6 times as many. So in the age groups that have the most amount of COVID deaths, and here you're thinking above 60, above 70, above 90, men are dying much more than women, sometimes 2.5 times as much.
Wow. Yeah.
The study says that the pattern is broadly similar across countries, and more research should be done to understand the interaction of age and sex and other risk factors, especially so because men and women often have different lifestyles. Men tend to smoke and drink more and have other comorbidities. These data alter our understanding of male-female differences. The relationship is not straightforward, and efforts should now be made to understand risk based on the interaction of sex and age along with other factors. That's what I wrote. There can also be a push for a broader collection and release of sex disaggregated data, as it is necessary to understand the nature of COVID more broadly, but also how individual patients might be treated. Well, you could imagine if you're a doctor and you're looking at a patient and you're thinking what their risk factor is, if it turns out one variable, like their sex, male or female, might imply a twofold risk factor, well, that matters. That really does matter. You'll notice.
Are they dying more, or are they getting infected more, or is it all sorts of things? All things being equal, if two patients are coming and presenting similar symptoms, is that actually a difference in the risk factor?
Exactly.
You need to understand it a bit more, right?
Well, more data the better to make an informed decision. Now, you'll notice that was a decent cross-section of countries. It's quite a few, but there was no United States. To fill that gap, there was a study in PLOS One by Vadidi et al., published just recently in January 2021. The title is Sex Differences in Susceptibility, Severity, and Outcomes of Coronavirus Disease 2019. Cross-sectional analysis from a diverse U.S. metropolitan area.
Only one area?
Correct. Just one. Their intro states, quote, evidence from China and Europe has suggested that mortality from COVID-19 infection is higher in men than women. but evidence from the US populations is lacking. Utilizing data from a large healthcare provider, we determined if males, as compared to females, have a higher likelihood of SARS-CoV-2 susceptibility, COVID-19, and if among the hospitalized COVID-19 patients, male sex is independently associated with COVID-19 severity and poor in-hospital outcomes. So I'm going to skip over some of the methods, but you can find the paper from our links on our website at trcpodcast.com.
Great website.
If you're curious, the diverse U.S. metropolitan area mentioned in the title is Houston, by the way. So what did they find? Quote, we analyzed a large population sample of more than 95,000 tested and more than 4,500 hospitalized individuals from one of the most diverse U.S. cities. After adjusting for several key socio-demographic, clinical, laboratory, hospital course, and treatment variables, we demonstrate a clear and strong independent association between male sex and higher SARS-CoV-2 susceptibility, greater likelihood of ICU admission, utilization of mechanical ventilation, and longer length of stay, all clinical indicators of higher severity of the COVID-19 disease.
So they're not only getting it more, when they get it, they're more likely to have complications. Is that's what it's saying?
Yes, after they've balanced for many things.
Okay, perfect.
And then it also says, these findings are congruent with the approximately 45% higher risk of in-hospital mortality among males as compared to females. So this is a different way of expressing a ratio, but it's indicating that if you were male, you have a greater 45% greater risk.
Okay.
In the United States, sex disaggregated data is not uniformly nor consistently available, but it can be made available in some cases, in some places, if you have the right access and if the organization, like perhaps this Houston healthcare provider, has done the work to provide it. The U.S. has the highest number of cases in the world, so it certainly would be useful if the U.S. tracked this stuff overall.
Yeah.
Why are men dying more, though? Quote, the underlying mechanisms or drivers of the observed sex differences are yet to be determined. Doubt. The paper does mention what I had recently said about lifestyle differences like smoking and drinking and more comorbidities in men, but, quote, in our cohort, the disparities remained even after controlling for these potential confounders, end quote. The study then lists a variety of ways men and women differ in ways that may be clinically relevant, such as response to foreign and self-antigens, men being more susceptible to pathogens while females mount a stronger antigenic response to infection, vaccines and self-antigens at the cost of higher prevalence of autoimmune disorders. Additionally, sex differences may exist in angiotensin converting enzyme ACE2 receptor and the cellular serine protease TMPRSS2. I know you're all thinking about that, which are responsible for viral entry and priming respectively.
Okay.
Yeah, you all saw that coming. So
Yeah,
I was hoping they would mention it. Oh, gee, it turns out, science is complicated.
Yeah.
So it seems pretty clear that COVID kills men more than women. Why haven't I heard about this? When I asked around, it seems most people didn't know this either. Listeners, I ask you, did you know this?
I'd heard about it like in April, but yeah, it wasn't very widely reported.
No. So why didn't I know? Well, various hypotheses start running through your head. Perhaps coverage was there and I wasn't as thorough as I thought in my COVID-19 news. Perhaps I did see it, but then I forgot. I know others who follow this news every day, COVID stuff, and they didn't know it. Then I wondered if there was some media bias. Ah, yes. Of course, good old white men get lots of attention in numerous domains, and to correct for that, problems affecting them more sometimes get some less attention proportionally. Could that be it? Well, more men die of a lot of things, and that just doesn't make the news, so perhaps that is just the pattern that's been followed. I Googled COVID-19 kills more men, end quote, and got a rather embarrassing broad range of articles that have been published on the topic. Yeah. In October 2020, the Washington Post is the headline, Why the Coronavirus is Killing Men More Than Women. All right. Well, in Nature, in August 28th, 2020, the coronavirus is most deadly if you're older and male. In The Guardian, in June 2020, why does COVID-19 kill men more than women? Researchers, right? And Wired in July, COVID kills men more than women. Experts still can't explain. Okay. So it's hard to say it didn't get any coverage. That's clearly not the case. But it can still be true that it got much less coverage than, say, how the pandemic has affected women more economically. Yeah. Thus the term she-cession. Perhaps another one is that I'm more likely to be influenced by Canadian and U.S. data and news. I'd like to believe that maybe that isn't the case, but I live in Canada. We get a lot of U.S. information. It's not like I'm getting that much of my news from Thailand.
Yeah.
As I said, the U.S. sex disaggregated data just hasn't been readily available. Yeah. What about Canada? Well, I track the number of active COVID cases in Ottawa each day, and if you look more closely at the Ottawa Public Health Dashboard, which has more data, it shows that slightly more women have died. Huh. So COVID-19 kills more men than women almost everywhere, but not Ottawa? Or maybe even Canada?
Huh.
So the National Post has an article from late November 2020 with the title, Beyond the Numbers, Who is Dying of COVID in Canada and How?
Yeah.
Sex isn't mentioned once and no data is provided. Yeah, I know. Who is dying and how? You didn't think to include that? Okay, so then you think that was disappointing. On our Government of Canada website, it says, quote, of the COVID-19 cases reported in Canada to date, approximately half, 51.6%, are female. But it isn't easy to determine deaths. I looked for a while. I'm like, come on, can't you make these things easier? Of course, you don't just want the number of reported cases, nor the reported deaths, but you want both or all four, right? 2 for each sex to understand the case-to-mortality ratio and then compare them.
Yep.
Global News had a piece from back in May. More Canadian women have COVID-19 and are dying as a result, and here's some possible reasons why. Like, well, that seems promising. The article suggests that because deaths in Canada were predominantly in nursing homes, and those who live in nursing homes are predominantly women, COVID has killed more women than men in Canada.
Why is that? Because
Well, why is that might be a different issue, but it could be that women tend to live longer,
sure,
and they're just more likely to be in nursing homes because of that.
but that's true worldwide that women live longer. Right?
That is, I'm not saying that's not true. I don't know.
Yeah. Okay. But and nursing homes aren't necessarily a
Maybe it's-
cultural issue everywhere in the world where people live with their in-laws. And
It
things like
could
this
be
forever.
even more disparate. It could be even more disparate in Canada.
Yeah.
I don't know.
Okay.
Here's a quote. As of May 15th, 55% of confirmed cases of COVID-19 are women and 45% are men. Of the total deaths, 53% are women and 47% are men.
Oh,
Note that that's back in May, so it would be good to have more recent data.
sure.
But in some countries, men are dying at twice the rate, while in Canada, it looks like men are only dying slightly more once they have the infection. Now, again, to quickly go over those numbers, I said 55% of confirmed cases of COVID-19 are women, and 53% of the deaths are women. So that does mean
So they're still dying at a slightly lower.
slightly lower.
Rate
Exactly. So
for
it's still happening. And in Quebec, quote, close to 60% of confirmed COVID-19 cases are women, and around 54% of deaths are also women. So again, there's also a small difference there.
Yeah.
But what's going on? Now, why would this be? I don't know. Perhaps there aren't as many health disparities in men and women in the Canadian population, meaning men may be more likely to smoke and drink more and be overweight more in other countries than in Canada compared to women. Again, don't have data on this.
What about working habits or something like that? More women at home in other countries where there isn't an equal amount of participation in the workforce. I'm just speculating.
I know.
Right?
We're
There
just
could be a lot of issues.
We're just guessing. Yeah, could be smoking, could be something else. Are there different demographics where more men have already died and there's just women are around? I don't know.
Yeah, maybe men. Yeah, maybe men. Well, it's not the case in Canada that like a bunch of men died in a war in the 1990s. Or
Correct.
something like that, right?
Correct. So I don't understand it. Maybe a knowledgeable listener will write in, and maybe that's a future segment. So in summary, COVID-19 kills men more than women. This is true in numerous countries, from European countries to South Korea and China to the United States and even in Canada. Exactly why the rates are sometimes 2.5 times as high and then much less in other places depends on a whole range of factors, which unfortunately are not currently understood and will have to be determined by future research.
Very interesting, Darren. Now, I'd heard these numbers a long time ago, and you know, I'd heard them repeated as, you know, people aren't talking about this because no one really cares that men die, which I think there's sort of this tendency for people to be kind of protective of women, right? Which can be good and can be bad in some ways when that can be too paternalistic or whatever, something like that. So I think that may be an issue. So I wonder if these numbers were reversed and women were dying more than men, if it would be more reported. It's hard to tell without seeing that specifically. But just the mystery over what's causing it is an issue here. I don't think there's any reason to act differently. I wouldn't say like, well, women don't have to wear masks and men do. Like that, you know, that doesn't make sense. Obviously,
No,
do
but
you want to prioritize vaccinating men or something like that? I don't think that makes much sense either. Right?
well, so that doesn't make sense politically.
Yeah.
But if you're thinking in the abstract, population A, population B, in many countries, population B, in this particular age group, say they're in their 70s, has 2.5 times the risk of getting this, which also in most cases means at least over 2 times the chance of dying. Like, well, yeah, that's you're going to give it to them first, like you just would. If the whole idea is you're prioritizing the elderly because they're the most at risk, you'd pick the most at risk within that category. Also, now again, politically, terrible idea. No, you're not going to do this, not at all. We'll forget it, right? It's also like if it somehow turned out white people were 5 times more likely to die of it. In this day and age, no, you just wouldn't say now white people are going to get the vaccine first. It's just not a good idea.
And there's other factors too, right? Like, so my father can't get the vaccine, but my mother can. Well, the best way to protect him would be for her to get a vaccine.
Well,
so
exactly.
you kind of you just got to protect your population, right?
Right. And there's different defensible ways of doing it, whether you're doing elderly and frontline workers in a certain sequence or not in a certain sequence. There are trade-offs, life years and everything else. And so, yeah, I think there's different defensible ways of doing it. To your point, counterfactually, if it was the case that women were dying at 2.5 times the rate, I feel like I would have heard about it more. Mm-hmm. And I do wonder why I didn't hear about the male thing more. As I said, it could be just my own media diet and how I'm not reading broadly as I thought, or it did get reported, but as I said, it just was fractional compared to other things. I would have thought this was so significant, it would have been more well known, if not amongst many other people.
Yeah. Or if we'd heard about it more, would it make much of a difference? I don't know that it does.
Well,
except for those who work in the healthcare field that would maybe need to know this kind of thing. Right?
I guess if you were a man in your 60s, you might think, "Oh, my risk is more than twice my wife's."
Sure.
Maybe that changes. That does seem useful to know. And certainly, if you go to see a doctor and they're just helping you out with your life in general, like, oh, by the way, just so you know, you're at twice the risk of dying from this.
Yeah, I guess you're right. There are things you worry about, right? Women worry about osteoporosis, so they got to make sure they get their calcium. Like there's things when you have a risk factor, you want your public to know these things, right?
Right. Mm-hmm. And I also think, like, depending on how you look at aggregated stats, if you're looking in aggregate, a woman is overestimating her risk. Right? Because it would include the higher risk men.
Yeah.
So again, we don't necessarily want people to change much of their behavior. We want people to, be cautious, wear masks, stay inside, this sort of thing. But if you're then overestimating your risk, well, maybe that's good, maybe it's not, but it's better to have some notion of truth.
Yeah. Yeah, even though it's very hard to accurately predict your risk level in most things.
Of course. And it fluctuates, and it's going to depend on the country, and even countries that have perhaps a similar disparate ratio, it might be for different reasons, right?
Yeah.
We'll see what happens, see what the future research holds.
What's up, cuboids? Cuboids are oblong, potato-shaped people. Hasbro, the company which makes the Mr. Potato Head toy, was the center of great controversy last week when it was revealed at an investors' meeting that it was rebranding Mr. Potato Head simply as Potato Head. The reaction from some was outrage that Mr. Potato Head was getting neutered and that this was somehow part of a nefarious, progressive, liberal agenda. Hasbro later confirmed that Mr. Potato Head wasn't going anywhere and shared a few images of the packaging of some Mr. and Mrs. Potato Head toys. These featured a new logo stating only Potato Head, but the toys themselves were clearly called Mr. Potato Head and Mrs. Potato Head. Those names were included in a number of different languages because being inclusive is cool. There was a lot of joking and a lot of memes going around about this on the internet. One joke in particular, which I found funny, was something I saw in a tweet by writer Matt Iglesias. Now, I'm not sure if he made this meme or not. The image showed Steven Crowder using a Change My Mind meme, which read, "There are 2 genders of potatoes. Change my mind." So a little background on the meme itself. Steven Crowder is a political commentator. A recurring bit of his is his Change My Mind table, in which he would sit at a table behind a poster showing some statement, which he believes to be correct, with the words "Change My Mind" under them, inviting people to debate him. So he wants to debate college students. He wants to debate these sort of woke liberal college students. Now, my understanding is that his mind is generally not changed. He doesn't actually expect it to be changed, but that's the bit that he's going for. Now, the meme template is to replace a sign which originally read, "Male privilege is a myth, change my mind." I'm not going to debate that particular question. It's out of scope for this episode. But the joke there was, "There are 2 genders of potatoes, change my mind." So for reference, no, Steven Crowder did not make that statement. So I thought this was funny. My automatic assumption was that this is, of course, nonsense. But then I wondered, what's the real answer to this question? Are there 2 genders of potatoes? So the real issue here was that I didn't really know how plants reproduce sexually, and therefore I wasn't sure if potatoes had sex. Potatoes can reproduce in two ways, sexual reproduction and asexual reproduction. So Mr. Potato Head is asexual? So a potato is a tuber. It's a part of a plant used to store nutrients. Asexual reproduction is similar to using a cutting of many kinds of plants. So, you can cut a piece of a vine and grow a whole vine out of it or something like that. So you cut up the potato in pieces. You make sure that the piece that you've cut has an eye. And then you can plant that piece. The new plant will grow from it. The roots and sprouts come out of that eye, and the resulting plant has the same genetic material as the original potato chunk which was planted and the plant that it came from. It's asexual in that there is no mixing of genes with another member of the species. You only need one potato to start a whole potato crop. So it's like a cloned potato plant, no genetic variation at all. So there's no Mr. or Mrs. Potato Head here. But what about sexual reproduction? Well, this is the old birds and the bees, and I guess I never really understood what the birds and the bees was. I guess I never really got that part explained to me as a kid. So plants, like humans, have gametes for sexual reproduction, male gametes and female ovules. This allows for the mixing of genetic material, which helps with variation. But despite what Hasbro has been teaching us since the 1950s, the potato doesn't have a penis or a vagina. Potato plants, like many other plants, have flowers. There are male and female flowers, which can be on the same plant. The male flowers generate pollen, which can be carried to the female flowers either through the wind or by insects. So you think of a bee, which gathers pollen, moves from flower to flower, and therefore it allows flowers to pollinate. This produces sexual seeds. These seeds then grow into potato plants, and that plant has its own unique chromosomes, which are a mix of genes from both parent flowers. There are types of plants in which a plant can be male or female and only have male or female flowers. There are also monoecious plants which have both male and female flowers on the same plant. This is the case for the potato plant. So in this case, only the flower has a sex. It wouldn't really make sense to say that the entire plant has a sex. There are also plants in which the flowers themselves are hermaphrodites, meaning that they are both male and female. Now, humans similarly have sexual reproduction. I would expect our listeners know how that works, though bees aren't involved and we can't reproduce asexually. All right, so does a potato have a gender? Well, that's not really a question which makes a lot of sense. The concept of gender doesn't really apply to plants. Instead, we might ask if a potato has a sex. Perhaps we can say that the flowers on a potato plant have a sex. Male and female flowers exist where a male flower can't pollinate another male flower and a female flower can't be pollinated by another female flower. But the potato itself is not a flower. Like I mentioned, it's a tuber. Some think of a potato as a root because it's under the ground, but it has characteristics more similar with a stem and happens to be underground in that plant. Carrots, on the other hand, they're a root. They're the root of the plant. They exhibit different qualities than a potato, which is in part why carrots and potatoes taste different. So potato does not have sex and certainly doesn't have a gender. But Mr. Potato Head is not simply a potato. He, and that's right, I called him a he, is an anthropomorphic potato, meaning that he exhibits certain characteristics of a human. While potatoes have eyes, they do not have animal-like eyes like Mr. Potato Head has. They also don't have noses, teeth, ears, hands, feet, hats, and mustaches, but Mr. Potato Head can have any of these things. So while a potato doesn't have a gender, one can certainly argue that Mr. Potato Head does, as people do. I'm not going to exhaustively look at the difference between sex and gender here, but in this case, we're talking more about gender than sex. Sex is the biological difference between male and female, where the flowers on a potato plant have a sex, as humans do. Gender is the social concept, so it can be based on a social role, a so-called gender role, or a person's self-identification, what we call their gender identity. So it strikes me that gender is generally a human-exclusive thing, as non-human animals, let alone plants, don't seem to have a concept of a gender identity like people do. So again, Mr. and Mrs. Potato Head are anthropomorphic, so it's safe to say that along with their mustaches and pouty lipstick-covered lips and even eyes with eyelashes, they also embody the human concept of gender. So these are gendered sort of traits. They are fictional characters and therefore have a gender attributed to them as a fictional character might, right? Bugs Bunny has a gender, Superman has a gender because these characters were created with a gender in mind. A hunk of plastic does not have a will of its own or a gender identity, but the person putting together the pieces of plastic are free to attribute whatever identity that potato that they would like.
The important question, are there two genders of potato head? Well, they are anthropomorphic, so it really depends on whether or not there are two genders of humans, because the potato head is like a person. This is, of course, a controversial and debated question, but the idea which I subscribe to is that gender exists on a spectrum, therefore can't be restricted to the two common genders, man and woman or boy or girl. As gender identity is determined by a person who is expressing that identity, that person's own gender identity can be what they say it is, including something that is not man or woman. That said, gender, like sex, is bimodal, meaning that most people are a man or a woman. There are also some people who are non-binary, don't have a gender, are gender fluid, or otherwise have a gender identity which does not fall neatly into the categories of man or woman. So just because most people fall into those two main categories and they are roughly 50-50, that doesn't mean that those other genders are any less valid. That's just kind of what bimodal means. Sex is similarly bimodal. Intersex is a fairly rare exception to male and female, but we don't need to get into sex characteristics of potatoes for the sake of these toys, which don't have genitals. I think gender will suffice for what we're talking about. All this to say, if there are not strictly two genders for people, then there aren't strictly two genders for potato heads, which are basically potato people. You can give your Mr. Potato Head both a mustache and lipstick-covered lips and eyelash-covered eyes, and that can be a Mr., it can be a Mrs., it can be neither, it can be whatever you want it to be. You can change your potato head's expressed gender by changing its parts. Whatever you, the creator of the potato head, decide is the identity of your toy, that's just what it's going to be. It's a freaking toy. Have fun with it. You don't have to respect the toy like you have to respect a person when a person expresses a certain gender identity. All this said, I know I've conflated sex and gender in the past, and these issues can be a bit tricky, as different people seem to have different ideas of what exactly those terms mean. So if I've said something that seems incorrect to you, please write in. I'm trying to be open-minded, and I like to learn more about these issues when people do write in. I appreciate that. If you're a potato, also, please do write in. We'd love to hear from you, because I don't think we've ever gotten fan mail from a potato before. There are not two genders of potato. Potato plants have flowers, which have a male or female sex, but the potato itself is sexless and genderless. Potato heads, on the other hand, can be a Mr., they can be a Mrs., or they can be anything else. They can be non-binary, gender fluid, they can be gender non-conforming. A potato head can be what you imagine them to be. Peace out, Cuboids.
For show notes or to discuss this episode, visit our Facebook page and website at trcpodcast.com. For general inquiries or to send a topic or parody suggestion, email info@trcpodcast.com. Help support the show by leaving a review on iTunes and liking us on Facebook. Follow us on Twitter at @TRC_podcast.